Hello, everyone. Welcome, welcome. We're just waiting about 30 seconds to a minute or so more while we wait for everyone to join the call. But we're delighted you're here. I have just put in the chat a reminder and encouragement for everyone to share your name, include your pronouns, if you will, and as well as your organization and your role, just so we can get familiar with everyone joining on the call. It's going to be an interactive session today, and just delighted you're here. So please welcome extra bonus points if you add in, if you are serving on the steering committee or a co-designer team member as well. That could be helpful for our audience today. Thank you, Lisa, for kicking us off in the chat there. Appreciate that. So welcome, everybody. I'm Colleen Zubik. I'm the Managing Director for Early Childhood and Health Systems here at Share Our Strength, and really delighted to welcome everyone to our second webinar for the Medicaid Food Security Network. So delighted you're here. Here's a slide. Thank you, Laura. Just to remind people, I see names streaming in the chat. Thank you, Rich, for mentioning that you are a steering committee member. I think it's helpful for everyone to know that. So delighted. Just a few reminders. We're all familiar with Zoom, maybe too familiar with Zoom, but we will be recording this meeting for those who aren't able to make it. We will be using the chat feature, so feel free to submit questions through the chat. We'll have some time during the Q&A near the end of the meeting as well. And then also, please make sure you're muted. Some Zoom conversations, you're automatically muted. This is not one of them. So please help everyone out by making sure that we don't listen in on dogs or kids or anything else going on in your background. Appreciate that. Next slide, please. Great. Well, much has been happening in the field and also in the network since our last webinar quarterly meeting. There's wind in our collective proverbial sails, and I am just so grateful for everyone's participation in bringing the network to life and in shaping its value. Thank you to everyone joining us here today, and deep gratitude to the co-designer team and steering committee and the other leaders contributing their expertise and perspectives to our strategic discussion today. Our meeting objectives, which you can see on the screen, include bringing you up to speed on the Medicaid food security initiatives and resources, and we've got lots of exciting information to share there, as well as doing a deeper dive on practical and policy opportunities to address food security in Medicaid. And today, we're excited to be focusing on data sharing and enrollment. And we'll also be sure to make time for structured collaboration through our breakout discussion rooms and through Q&A in the chat. Next slide, please. Great. And so our meeting flow looks like this. Just me kicking us off, and then you'll learn more about the Medicaid Food Security Network initiatives and other resources. And then we have a policy and program spotlight, which will be a regular feature of our webinars. And today I'm so excited for Jamila McLean from BDT talking about how sharing data builds more effective benefit systems. It's going to be a wonderful but brief presentation, because then we have an amazing all-star lineup of breakout room discussions so that we can facilitate some more tailored interest around things like SNAP and Medicaid policy and enrollment, WIC and Medicaid policy around enrollment, technology infrastructure, community-based organizations and data sharing, etc. You'll get a full overview of what the breakout rooms are, but I just wanted to let you all know that it's worth the wait. It's an hour-and-a-half meeting, but those are going to be a stellar opportunity for some deeper dive discussion. And then we will do some general Q&A and close out. So again, thank you. So excited. Glad you're here, and let's get going on learning. Audrey or Catherine, I think you're going to take us into the initiatives launch.
Sure. Thanks, Colleen. First, I wanted to start with a poll just to get a sense of who's in the room. Let's figure out how to launch that. All right, quick poll of which state you're in. It didn't let me do more than 50, so if you're national or DC, put that in the second question. And then what type of stakeholder you are. This really helps us just get a feel for who's in the room. We'll give it another 10 seconds or so. Okay. Looks like we got representation from many different states, which is exciting to see. I'm personally in Washington. Um, we have a few bit of national organizations or DC. Mainly we have food advocates here and other, but we also have some people from Medicaid agencies, medical providers, health plans, researchers. So pretty indicative of the diversity of stakeholders we need for these efforts. Okay. So my name is Audrey Immel. I'm the program manager with Share Strength on the health systems team. You can go to the next slide, Laura. So just starting with a refresher of what the Medicaid Food Security Network is, our mission and vision. So our goal is to support anti-hunger advocates and other healthcare stakeholders to adopt and implement effective strategies to support the full spectrum of food needs of children and families enrolled in Medicaid, with that special interest on closing the enrollment gap in SNAP and WIC. And how we will do that is partially through these convenings, so information sharing, getting all the folks together to collaborate, providing technical assistance and tools for policy and advocacy. So next up, I'm going to go through some of the resources we are excited to release. First off, we have Colleen here on screen. We have the Medicaid 101, Medicaid and Food Security 101 video learning series. It's on our website now. I'll drop a link in the chat. This is a 6-part video series that is great for people just diving into Medicaid and how Medicaid can be leveraged to address food insecurity, or anyone that wants a refresher. We've gathered resources from many research organizations. It was a really collaborative effort, so I'm excited for you to check that out. Next up. Okay, I'm going to pass it to Catherine to give some context for this policy dashboard.
Hi, everyone. It's so nice to see so many familiar names. I'm Catherine Jantz. I'm a senior associate at Health Begins and excited to be joining you all today. So as I'm sure everyone on this call knows, Medicaid addressing food needs is a relatively new strategy. And like many new strategies, it can be hard for states to adopt new programs. They might have capacity challenges. They're dealing with many different benefits and strategies and needs of the Medicaid population. And so we really wanted to think about ways that we could reduce barriers for Medicaid agencies to adopt new strategies to address food insecurity. We wanted to make sure that advocates and other stakeholders had information and resources so that they could engage with their Medicaid, their state Medicaid agency. And we wanted to increase transparency and visibility about the requirements and strategies that are already in place. So in order to do that, we researched every single state and pulled examples of how they are addressing food insecurity. Because part of our goal is to really give concrete examples that would help a Medicaid agency, that would help an advocate, we use as much as possible, we tried to use the state's language, and we link to the original source document. So in a second, Audrey will walk you through how to use this tool, and she'll show you that you can literally see our short summary, but then you can click on the link to the right to be taken to the contract or waiver document or other official document where that information came from, so that you can check it yourself and so that you really have the information you need to point to the necessary resources. We also really hope that if you find that you look at the requirements in your state, please let us know if you have any recommendations for changes we should make or updates that we should make. We really will need all of you to keep this tool as up to date as possible. If you see a strategy that excites you, we encourage you to outreach your state or outreach your local Medicaid MCO to learn more about how it's being implemented and what are the challenges in that implementation. With that, I'm going to turn it over to Audrey. Would love to hear any questions. I hope we can put the link in the chat. I hope and invite everyone on this call today to go ahead and look at the tool, and we'd love to hear if it's helpful to you. I will put the link in the chat while Audrey talks about how to use it.
I'm going to hijack screen sharing for a second. Okay. So again, a tool is only as good as whether people can use it or not. So I'm going to try to help you learn how to use this policy dashboard. This is the landing page. So we have a summary. Here is the dashboard itself. But some other important resources are, I made a little video on how to use the dashboard. We have definitions for our policy categories that we used, as well as a bunch of acronyms down here. So now going up. So it's easiest to use the dashboard in full screen mode. So I click down here. The cool thing is you can sort either by state or policy category or both. So I'm in Washington. So let's say I just want to know what's all going on in Washington. I can go down here. Of course, we have the 1115 waiver description. I find it easier to put this in focus mode. So it turns into full screen. Again, here's the original source documents. You can also, so then you just click the state again to go back to the map. You can also say, I'm really interested in all direct investments and benefits. So these are the ILOS, 1115 waiver, all of that. You can see everywhere that we've tracked states are doing this. And again, we've probably missed some. It's not exactly comprehensive, but we tried our best. So you can explore that way. You can do a bit of both. So we hope this is helpful for you as you're doing your research and kind of brainstorming how you can start engaging with your Medicaid agencies.
I want to take a moment to pause while we get the screen sharing back up. Were people able to get to the link I put in the chat? Are you ready? Do you have questions, initial feedback, thoughts? I see a thumbs up from Shane. Thank you. Thanks for. Oh, your healthcare firewall is blocking it. Oh no. Well, that's good. That's good to know. I don't know exactly what we do about that, but it's good to know that some people might have challenges accessing. Are other folks having challenges accessing? Getting one positive, that's good. All right, this is a new tool. So like anything that's new, we are very interested in your feedback. We want to hear, where you're running into challenges and using it, but also really want to hear how you are using it. It's helpful for us to know what the value is for you. Oh, that's interesting, Emily, that it was concerned it was mimicking a CMS webpage. I wonder if there's something we can do in the labeling or something that would help that. Thanks, Kristen. Would be grateful for your feedback. All right, we can go on to the next slide, but we'll be monitoring the chat this whole presentation, so feel free to pop in and ask questions or continue to engage with us on this. So also wanted to highlight that we in our last meeting, we talked about a range of promising strategies, and you saw in the outline of strategies that we highlighted in the policy dashboard that those range of strategies. We've synthesized what we think the opportunities are for Medicaid agencies in a document called the Promising Medicaid-Based Strategies to Address the Food Needs of Children and Families. This document really is to describe the full range of strategies that a Medicaid agency might engage in, from things that are a lighter lift, like, including a requirement to do social needs screening as part of health risk assessments that are already a requirement of MCOs, to strategies that are much heavier lift, like the 1115 waivers and in lieu of services that I'm sure you're all hearing a lot about. The goal of this document really is to give all of you a resource, whether you're a Medicaid agency or whether you are a stakeholder, to really think about what are the ways that you could be addressing food in your state through Medicaid. You are welcome to use ideas or language from this in communications that you're sending to your Medicaid agency, in thinking about how you partner with your local MCOs. This really is a tool for you just to think about the range of possible ways that a Medicaid agency might be able to address the food needs of children and families. We would, again, always love to hear if there are strategies we missed, and if there's other things we should consider including in future iterations of this document. And I want to give a huge shout out to everyone on our steering committee. I see many of our steering committee participants on the call here today. They were really the brains behind this document. We spent quite a bit of time in person in December, really thinking through what all those strategies should be. And then everyone on the steering committee was heavily involved in line editing this document over the following months. So it was about a 3-month process. And so we're really excited about this resource. Yeah, Kristen, I think that's a good question. We have thought about school-based health Medicaid services policy. I think there might be more opportunities there, and would love to hear more about what you're thinking. Any other comments? Anyone from the steering committee want to share anything? Questions? And I wonder, does someone have the link to that document handy? I want to go ahead and put it in the. Do I have the link? Perfect. Thanks, Julian. So the link to the Promising Strategies document was just placed in the chat by Julian. And again, would love to hear your questions, feedback, thoughts. Oh no, Amy, you're not able to access the website. We'll have to figure out if there's anything we can do on our side. Thank you for letting us know. Anything else before we move to our next agenda item? All right, next slide. And again, please let us know if you use this document, if it's helpful. We'd love to hear about it. So in that vein, we want to hear and would love to have people come off mute or share in the chat. What support do you need in advocating for policy change in your state? Do you think these resources would be helpful? Are there supports you need that aren't part of these resources? And we'd love to hear specifically if your state has upcoming policy changes that you think might be an opportunity. We'd love to develop partnerships and relationships with stakeholders and states that are really thinking about these strategies, so that we can really make sure that they impact children and families, as well as populations of people with high clinical need. Catherine, I see you're raising your hand. Thank you. Thanks for coming off mute.
Hi, everyone. I'm Catherine Couch. I'm the founder and CEO at a medically tailored meal organization called Series Community Project in Northern California, and part of the California Food is Medicine Coalition, and have been involved for quite a while in California around this work. And one of the biggest things I want to talk about is rate setting. Is a huge issue that I just was on a call with the folks at Chilpy around North Carolina and Massachusetts. And one of the big challenges is that if rates are not set in a way that adequately compensate CBOs who are providing these services, it's impossible for CBOs to scale those services and to do the work sustainably. And there is a continual undervaluing of food and what it takes to actually source, produce, and deliver food that is quality, in a way that makes a difference for patients. And I just can't underscore this enough. In California right now, it is a root issue around a whole set of interconnecting things that are not working for CBOs to be in the marketplace. And part of what I think that we want to do, and this is also happening in California, is the vision for CalAIM is that we build a expanded healthcare collaboration at the community level, including CBOs who are trusted partners with the populations that we're trying to serve. And the rate issue becomes really important because if CBOs aren't compensated and can't scale, then the only alternative for plans is to go to venture-funded for-profits, which do not help support community capacity and community investment. So, I could go on for an hour on this topic, but I just can't underscore, as someone who's been involved in this work for 7 years in California, that the rate setting issue and definition of services related to those rates is critically important.
I'm so glad you raised this, and there might be an opportunity. We're trying to elevate some of these policy issues as much as we can through writing and presenting, and maybe this is a topic that we should tackle in greater depth in the future, because I think, yeah, I see Kristen posted this, and I know I've been talking to Dawn and others in Michigan that this is, other states are really, who are earlier in their benefit definition journey, are really starting to think about this now. So this is a great moment, especially for states who are very early in their process, to learn from the lessons from states who've adopted earlier.
And I'll just add that related to this is a really, really clear definition of the distinction of services being provided, and the requirement that the state actually provide oversight around that. So in California, we've got medically tailored meals, home delivered meals, medically tailored groceries, healthy groceries, but there's no definition. In fact, the grocery definition doesn't even say how many meals have to be in that grocery bag. So it just creates this wild west where there's not clear distinctions and appropriate rates related to all of those things. So definition of service interventions is definitely highly related to the pricing and compensation issue.
Thanks, Catherine. I'm so glad you raised that. I think we have to move on to our next agenda item. But again, if you're in a state where, I see some comments in the chat, I'll be responding to those in a second. But if you're in a state where you think there's, interest in pursuing the 1115 waiver, you have an upcoming Medicaid managed care RFP, you think there's an upcoming opportunity, we would love to hear from you. So please put in the chat, feel free to reach out to us. We'd love to think about how your state can pursue some of the strategies in that promising strategies document. Next slide.
Okay, thank you, Catherine, both Catherines. So this initiative, the Medicaid Food Security Partners Program, is something I'm very excited about. So for some context, in addition to these more widespread website resources we've just released, we've also selected 4 grantees from 4 different states that we're doing targeted TA and investment to either adopt or implement effective Medicaid strategies to address food security. So I'm really excited to introduce those folks on the call right now. Go to the next slide. So we have groups from Georgia, Oklahoma, Virginia, and Michigan. And I'm going to let them talk for themselves about 2 minutes each to come off mute. So we can go to the first one. Oklahoma team, take it away.
Hi, everyone. My name is Austin Webb. I am the Northeast Regional Organizer for the Oklahoma Policy Institute. So we are a local nonpartisan think tank. We operate across the state. I'm based out here in Tulsa. Just a few of the things that we included on this were just some statistics about Oklahoma. We have a high rate of poverty in the state. We have a lot of people on SNAP as well. We're a state that's cheap to live in, but wages are also really low. So there are a lot of people who do suffer from food insecurity. Kind of the main things that we're working on with Share Our Strength are related to using broad-based community eligibility to expand income guidelines to kind of be more on par with Sooner Care, which is at 138% of the federal poverty line compared to 130% for food stamps. We also are looking at helping to create a universal application in Oklahoma. You can't go to the Department of Human Services or the Healthcare Authority or the Department of Health and get all SNAP, WIC, and Medicaid all covered under one application. We are exploring an 1115 waiver as well. That one I think would be a bigger lift for us. We just recently moved into managed care with our Medicaid program in the state. And so we are also partnering with them to try to expand some of the value added benefits that they have. Right now, they do have some services that address things like housing, food security, but we're trying to see what all we could do to maybe boost those benefits and help some of the folks out here. Was that 2 minutes? I hope so.
Perfect. Thanks so much, Austin. Pass it to Megan, I believe, from Virginia.
Sure. Hey, everybody. My name is Megan. I'm the Health Equity Director for the Federation of Virginia Food Banks. We're a state association, a statewide nonprofit that exists to support the 7 regional Virginia food banks. So we're doing some internal health equity work at each of the food banks, but then also looking externally across other food advocacy partners to lead a statewide coalition called the Virginia Food is Medicine Coalition to pursue reimbursement for food supports in Virginia. So we're doing all the work associated with that, convening this group, contracting with the former Virginia Medicaid director to advise us on statewide policy and advocacy strategy. And are really grateful to have support nationally to understand what's working in other states, how that work can inform the work that we're doing in Virginia, specifically looking to catalog food as medicine services, standardized definitions and services. So I'm glad to hear of the work already happening nationally on that front. And then strengthening our food as medicine strategy, tying in SNAP and WIC and screening and referrals into that strategy. And then right now we just went through procurement. So really understanding as we position ourselves long-term in support of reimbursement through Medicaid for food, how we should be working with plans through in lieu of service and value added benefit opportunities now, because we know we're getting approached now that procurement just started. We're getting approached a lot and trying to really figure out how to take advantage of those opportunities and really present a statewide unified front on the services that we offer and the cost and exact criteria, services that will be offered, et cetera. So thanks.
Thanks, Megan. All right, I believe this is Dawn.
Hi there, I'm Dawn Opal, and I am the Chief Innovation Officer and General Counsel of the Food Bank Council of Michigan. Like Virginia, we are also the partner state association for the 7 Feeding America member food banks in Michigan and their network of food pantries and other agencies. We are really at the beginning of the in lieu of service contracting process, which will take place in October in the state of Michigan. So we have designated 3 goals for our project. And really the focus is on support, utilizing this national technical assistance and cohort to create the most actionable and impactful implementation of this in lieu of service, and really work closely with our Michigan Medicaid office on the standardized guidance that they're going to provide to the Medicaid managed care plans, and then work with community-based organizations on their implementation contracting strategies. So we have some capacity building focus, as well as providing technical assistance to community-based organizations that are interested in participating in the in lieu of service provision. And I think our third goal is really to create a sustained feedback loop between food and nutrition service providers and our Michigan Medicaid office, as well as our managed care plans, and ensure that we really do, in this first year, have a strategy that moves us beyond small pilots with each of our several Medicaid managed care plans and brings us to a place where we're really working towards systems change in the integration of food and nutrition services into Medicaid. So thanks.
Thanks so much. Last but not least, Voices for Georgia's Children's team.
Hi, everyone. Kelsey Silvio, Senior Policy Analyst with Voices for Georgia's Children. We are a whole child policy research and advocacy organization. We cover statewide advocacy and research across the state, and we do that both legislative and administrative. We have a whole portfolio of different areas that we cover related to children's issues. That's children's birth through young adulthood, depending kind of on the program that those children are interfacing with. And the goals that we're really trying to push in this project are going to be around anything social, well, not anything, but a lot of social determinant of health, inclusions in our CMO contracts that are specifically related to food programming. So integration of WIC and SNAP enrollment within language within our contracts. Also the identification and implementation of any kind of automatic enrollment and referral processes within our Medicaid system, dealing with WIC and SNAP. And then we'd also like to, or we will be identifying and educating policymakers on the 1115 waiver options related to SDOH. And then aside from some of that, we'll be doing some work in our home visiting area to, right now, Georgia's doing a home visiting pilot. And we really want to make sure that SNAP and WIC are fully integrated into those processes with outreach and enrollment so that we can figure out kind of how to roll that out statewide because there's various home visiting models that are active in our state through just different state agencies.
Thank you, Kelsey. So those were our 4 grantees. I'm really excited about their projects. A huge goal of this grant program is to take learnings from these projects and disseminate them through the entire network. And so we definitely will be hearing from them in the future, and we won't keep you in the dark as to how their projects are going. So thank you.
Jamila, I think we'll pass it over to you to do our deep dive.
Awesome. Hi, good afternoon, everyone. I'm Jamila McLean. I'm the Senior Healthcare Policy Manager at Benefits Data Trust, and I'm joined on today's call with my colleagues, Julian and Ki, who will also be sharing it in some of our breakout rooms this afternoon. Audrey, if you don't mind going to the start of the slide deck. Thank you. So for today's presentation, the policy or process spotlight that we're focusing on is data sharing. So today I'm going to share a little bit about Benefits Data Trust as an organization, our sort of data journey, and some work that we've done around data sharing through our data sharing playbook, as well as a national survey that we conducted, because data is a really powerful tool for connecting folks across Medicaid, SNAP, and WIC. Next slide, please. So a little bit about BDT is that we are a national nonprofit. We're based out in Philadelphia, but we operate nationally. And we are really focused on harnessing the power of data, technology, and policy to ensure that individuals have dignified, efficient, streamlined access to all of the benefits for which they're eligible. Next slide. And overall, the problem that we are trying to solve is the $80 billion that are left on the table. It's no secret that there are millions of Americans or individuals in this country that are living in poverty, and we know that there are safety net programs that are intended to support individuals by providing them access to benefits that help with food, housing, heat, electricity, healthcare, all of that. But a number of individuals are not accessing that. And we know that millions of individuals are missing out on benefits. So we see our organization as an opportunity to help close the gap and ensure that folks are tapping into these benefits for which they are eligible. Next slide, please. So like I said, I wanted to talk a little bit about BDT's sort of journey with data and how we currently operate. So we were founded in 2005 through a partnership with the Pennsylvania Department of Aging, where we used data sharing and data matching to connect Pennsylvania residents to the prescription assistance program for older adults. And really, this idea of using data sharing and data matching goes back to our founder, Warren Cantor, who was kind of like thrown into the public benefit system when his mother was recently widowed and he was assisting her in getting access to public benefits. Later on in life, he found success in the financial sector and had the brilliant idea of using the technology that's used in the credit card industry to market to individuals to help connect folks to public benefits. This idea that was born out of there's data that exists that can help us identify folks that are eligible for benefits and not enrolled. And we can use that data to do proactive or data-driven or targeted outreach in these individuals to get them connected. And that is the model that we use today. At BDT, we get data from multiple entities, whether that be states, healthcare, institutions of higher education, and we're able to take those lists, look at the data across the different programs to identify individuals that are enrolled in one benefit, not enrolled in the next, and provide targeted outreach to those individuals to let them know of their eligibility. And in the states where we do operate contact centers, we're able to provide one-on-one targeted enrollment assistance so that we can help folks connect to benefits. In our direct service work, we have learned, and I'm sure many of you folks on this call know as well, that part of the reason why many individuals don't access public benefits can range for a number of reasons, from not knowing that they are eligible or that these benefits even exist, or the process being extremely cumbersome and difficult for folks to go from completing the entire application. So this is the model that we use today, and in helping us to do that, we have executed at least 40 data sharing agreements with the entities that I mentioned, like states, higher education, institutions, healthcare, etc. Next slide, please. So we know that data is a powerful tool. I would argue that there isn't really a shortage of data. It's just that we need to think about how we use data. And there are many different ways in which data can be used. First and foremost, to identify participation gaps and understand the scale of those participation gaps. At BDT, we have conducted pilot projects specifically around looking at Medicaid, SNAP, and WIC and identifying where there are gaps in cross-enrollment. And we were able to work with states to help them conduct data matches to identify folks that are enrolled in one benefit, not in the next, and see what the size or the magnitude of those gaps are. Data can also be used to uncover disparities in benefits access. States will oftentimes, and other entities will oftentimes have data across different demographic categories, age, race, gender, etc. And that can be used to identify which populations need to be targeted and which populations are left out. So data is a really important tool for addressing health equity or inequities in general. Next slide. Data can also be used to conduct data-driven or targeted outreach. As I mentioned, that is BDT's overarching model, which is identifying the individuals that are enrolled in one benefit and not in the next, and providing that one-on-one or that direct targeted outreach to connect those individuals to benefits. It can also be used in the case of renewals or the recertification process. Identifying individuals that are up for renewal, doing the targeted outreach, helping to ensure that they remain a part of the renewal process, or they complete their renewal so that they don't churn or cycle on and off public benefits. And lastly, but also there's a whole other host of ways in which data can be used. It is a really important tool for creating efficiency and streamlining for agencies and residents. I think most of us remember at sort of the height of the pandemic, there was a lot of struggles around states when it came to staff shortages. And with that, we saw backlogs, we saw increases in processing time, we saw really long hold or wait times for call centers. And that sort of struggle continues till today. And we know that we can utilize data in multiple ways to streamline that process. For example, using data during the renewal or the recertification period can allow states to help folks renew for their benefits without having to touch the case at all. That saves time not only for the beneficiary, but it also saves time for the state. And it allows caseworkers to really focus on the cases that are the most complex or the individuals that need the most help. So it's a win-win for both clients as well as for states. Next slide. Now, I know it all sometimes sounds really simple. You have the data, use the data, and we can make this an easy process. But we have to acknowledge that there are several sort of building blocks to data sharing and several things that states and other entities have to take into account when it comes to data sharing, because it is really important to ensure that the data that clients are providing remain protected and is being utilized in the way in which the clients expect their data to be utilized. So as states and other entities are thinking about establishing data sharing agreements and are thinking about how to utilize the data that they already have, there are a number of factors that have to be considered. There are several key legal questions that have to be answered. There are overarching federal laws, federal privacy laws, federal benefit-specific laws. There are state-specific benefit laws. There are the data sharing agreement components. There are technology issues. There are all of these different factors that have to be addressed before data can be shared. Next slide, please. And some of the key legal questions around can you share data, or how you can, or how to go about sharing data is who's the sharing? Who is sharing the data? Is the data going from the Medicaid agency to the SNAP agency, Medicaid to WIC, vice versa? Is this a dual or bi-directional sharing of data? Who is using the data? What type of data is being shared? Is it simply enrollment status? Is it other factors that can help determine eligibility? Is it health data specifically? And what is the purpose for which the data is being shared? And I think that this is a really important factor. And for BDT in our journey, in our data journey, the purpose in which we utilize our data is specific to that outreach and enrollment support. But that may look different for other states, for other entities, as they think about how to leverage the vast amount of data that exists. Next slide, please. And like I mentioned on the previous slide, there are a number of other considerations, particularly when it comes to what is allowed within the benefit specifically. This slide is a snapshot of our data sharing playbook, which we've also linked in the next one or two slides. So if you are interested in learning more about the specific components as it relates to data sharing and find some really actionable tools as you think or consider how you can utilize data sharing, I definitely recommend that you check out our data sharing playbook, because you'll see that there are very specific requirements or considerations or guardrails essentially around what data can be shared for, between or across what program, what benefit. Next slide, please. And next, I want to shift gears a little bit to talk about a recent survey that BDT conducted. This was done with support from the Robert Wood Johnson Foundation and in collaboration with the Center for Healthcare Strategies. As I said, we've been doing this work since 2005. And one of the questions that always comes up is, well, how many states are sharing data? What data is being shared? So in 2022, we conducted a nationwide survey of Medicaid and SNAP agencies to understand how data is being shared across both programs, what type of data is being shared, and how the data is being utilized. We have a number of reports available, so please feel free to check out the reports, which are also linked and will be in the slide deck once that is shared. But I wanted to highlight some key pieces of the report and of the findings for you all. Next slide, please. So there were 3 key findings that came out of the report. First and foremost, Medicaid and SNAP data are being shared across most states, and there was no real difference across the political spectrum, size, or region. So we knew that states were sharing data, but this was just confirmation that all states are really sharing Medicaid data, Medicaid and SNAP data. Secondly, in addition to the agencies sharing data across between the Medicaid and the SNAP agency, we found that most states were also sharing data with their managed care organizations, not surprising because most states operate in a managed care states, and with nonprofit organizations. And lastly, integration was not necessary for data sharing. Oftentimes, you might hear that it is simpler to share data if there is an integrated eligibility system or an integrated system where the SNAP and the Medicaid systems operate together. But we found that states that did not have an integrated SNAP or Medicaid system were sharing data at almost the same rate as integrated systems. Next slide, please. One of the things we wanted to dig into was what types of data were being shared. And of the states that did report that they were sharing data, we found that the data points that were being shared were typically the data that were utilized to determine eligibility. So in financial data like income, household size, some demographic information, and enrollment status was often shared between the programs, which is really important because it helps to underscore that states have and are sharing the data that is available to identify folks that are likely eligible for programs and to get them connected to those programs. Next slide, please. And this is actually a snapshot from the dashboard that was developed from the survey that we conducted. So if you are interested in learning more about how states are sharing data, if your state is sharing data and how the data is being shared, that is also linked in the slide deck. So you can definitely do some digging around to see how data is being shared. And I just want to highlight that the dark green part of this of the map shows states that are not sharing data specifically for the purpose of outreach. So we saw that most states are sharing data, and they are sharing those data items that are used to determine eligibility, but they are not using that data to proactively outreach to individuals that are eligible but not enrolled in the other programs. Next slide, please. And like I mentioned in the previous slides, data outside of sharing data across the Medicaid and SNAP agencies, third-party entities are also most commonly shared data with, particularly managed care organizations and nonprofits. And we found that a handful of the states that were surveyed actually required their managed care organizations to screen individuals for food insecurity and to identify individuals that were eligible for SNAP enrollment. And in additional work that we have done outside of the survey has suggested that managed care organizations are quite interested in receiving data on enrollment status for their members because it allows them to better address the social drivers of health by ensuring that their members are connected to all of the benefits for which they're eligible. Next slide, please. And like I mentioned, please check out the interactive map, which will allow you to sort of toggle back and forth some of the key questions that we had and filter and identify what is happening in your state. Next slide. And lastly, if you are interested in very specific examples of states that are sharing data, as a part of this study, we published 3 case studies focusing on 3 states, Colorado, South Dakota, and North Carolina. So I encourage you to take a look at those case studies to hear specific details of how these states are utilizing data to streamline enrollment into their public benefits programs. Next slide. And and again, just a reminder to check out our data sharing playbook, which is really a how-to guide to start or to improve data processing, data sharing within your state. And I think that is my last slide. So I will kick it back to you, Audrey.
Before we move on, just wanted to point out the Q&A. It looks like there's a question about whether BDT works with tribal communities.
Sorry, excuse me. We have not worked with tribal communities specifically in the, the work that I shared in our sort of history. We have not, but certainly we are open to that, of course.
Great. And Laura, do you want to talk about breakout rooms now?
Sure. Yeah, maybe, Jamil, if it's all right, if anybody has any burning questions, go ahead and feel free to air those, but we are going to have some really nice deep dive conversations through breakout rooms as well. So now this is the time where hopefully we can convince you to stay with us and not jump off. We're really looking for, we heard a lot of feedback from our first quarterly call that the breakout rooms were really one of the most valuable parts of the meeting. And so we really hope you'll stay with us. Thanks so much, Jamila, for such a fantastic presentation. Really excited to be able to dive deeper into conversation. I know there's been a huge amount of conversation going on in the chat, so now's the time when we all get to actually discuss live. So what we're going to do is we have 8 breakout rooms that we're going to open. Each one has a slightly different topic, as you'll see on this slide here. So as I'm kind of describing the process, please do take a moment to take a look and see which breakout room might be the best fit based on your interest, based on the work that you do, based on what you'd like to learn more about, really whatever suits your fancy. Each group is going to have a facilitator, so somebody who's either a representative of the co-design team, of the steering committee, which we referenced several times. And we also have one of our friends, Zoe Newberger from the Center for Budget and Policy, Center on Budget and Policy Priorities, very kindly joining us as well today. We'll have a little bit of time to just kind of get to know one another. And then we have a few really simple prompts that we are going to just use as our discussion points. That facilitator will also be taking some notes. Those are not going to be, shared in any inappropriate ways, but rather they're just information that our team will take back and use to fuel the work we continue to do. So thanks so much for engaging in the conversations. Any questions before we get started? I think from a logistics perspective, I'll just mention for each of our facilitators, you should be pre-assigned to your room, but if you find that you are not, just take a note of which number you are here on the screen. And so Audrey will launch those shortly. And for everybody else, really do want you to choose the one that works for you in terms of what you're most interested in. That said, if you see one room has 25 people, 30 people, and one has maybe 3 or 4, consider joining that smaller group. You might be surprised at what the value of the conversation is when we have those kind of more concise groups. So I think with that, we can go ahead and launch the rooms, Audrey. Great. So everybody should, I think, see a piece along the bottom panel of your screen that allows you to click breakout rooms and then self-select into one of the numbers that we have on the screen here. Killian, I'm wondering if you wouldn't mind checking in room 6. I'm trying to figure out how I can get into that room, but I think Elise would love to have a partner in co-facilitating that conversation. And if I can get over there, I will do so. Thank you.
Are you not able to join, Laura?
No, I'm seeing the management. I think there is a way that I can drop in eventually. But I'll figure that out momentarily.
The little box vanished. The little box vanished. And so I was just reading to figure out where to go, and then the box vanished. Can that just come
no.
back?
Let's see. I don't know, but I can assign you to a room. Sorry, who said that? I missed the name.
Miss
My name is
Tony?
Tony,
Hi,
and
Tony.
I'd like to go to room 7. Hi.
All right, thanks. Okay, one moment.
Thanks, Audrey.
And anyone else that can't get into the room, let me know and I can assign you.
Audrey, I think I figured out how to, I see now how I can join the room. So I'm going to go ahead and jump into room 6, but if you don't
Okay.
mind, I'll leave you here. And
Yeah.
if folks who are in this conversation here would like to just have a general conversation, you're more than welcome to do so. Otherwise, feel free to jump into a room as you see fit.
All right, sounds good.
Thank you. And Audrey, I'm not sure, are you all still seeing my screen on the breakout rooms by topic
I
in this
am,
main room? Okay,
though I'm not sure how that works if you leave.
okay,
I can share though, if it doesn't.
okay, great, thank you. Oh, yep, it said it will stop sharing screen, so.
Okay, I'll share mine.
Great, thank you.
Audrey. I got kicked out of my room accidentally because my computer shut down. I'm in room 7.
Welcome back, everyone. We'll just wait a couple more minutes.
Right. As we welcome people back, I realize I didn't introduce myself. Apologies. Hi, everyone. My name is Laura Cornwell. I'm with Share Our Strength. I get to work with many of the folks who you heard speak earlier today as part of the co-design team, and really grateful for you all for joining us today. Hope that everybody had good conversations. I know we certainly did in our room. And just want to open it up for a couple of minutes, either for our facilitators or for our general attendees. Anything that really stood out to you? Anything that you'd like to share with the group?
I'm happy to jump in. This is Rich Heward, and from Group 3 on SNAP enrollment and technology. And I feel like our group, even though we were a smaller group, really only touched or scratched the surface. And it was really great to hear, some of the challenges and barriers that others are experiencing in other states and the similarities among them. But would love to find more time in the future to dive deeper.
And Laura, I can quickly just elevate, and a huge shout out to Anne. We were in group 7 where we talked about community-based organizations, data sharing, and closed loop referrals. And we were talking about closed loop referrals and that needing to be a continuous loop, not a closed loop, because as individuals continuously need services and support, data and information need to be shared, not just with the plans, but also with the entities, the CBOs that are doing this work. And I think sort of like shifting to that continuous loop so that there's continued communication and engagement and data sharing across the entities is a really great way to look at things.
Thanks, Jamila, and thanks, Anne. I love that framing. Anybody else like to share anything that really stood out from your conversations?
I can share from Group 5. We were talking about various aspects of Medicaid and SNAP data sharing. One really interesting question that I wanted to elevate from that group is express lane eligibility for SNAP, or the lack thereof. So some of you all may know that there is this thing called express lane eligibility for Medicaid, which is if you're on SNAP or TANF or a couple other public benefits, there are ways in which renewal of Medicaid then becomes streamlined, but that generally does not exist with SNAP. And I think it'd be just interesting for our group to talk further about like why that doesn't exist and what are the steps we can take to move towards that kind of approximate vision, given that it doesn't exist right now.
Thanks, Julian. Actually, I think that kind of broad-reaching question, Audrey, if you don't mind, we can go forward a couple slides. Just open it up a couple minutes for just any questions, any conversation that folks would like to have, whether it was based on what we shared at the beginning of the presentation, the excellent presentation that Jamila offered around data sharing and or from the breakout rooms. It can sometimes be difficult or awkward in a large group. So we'll provide some ways that you all can get in touch with us at the end of the slides today. I think hearing nothing, Audrey, we could go ahead and move on, please. Great. So again, thank you all so much for joining us today. We had I think the highest number I saw was about 115 people, which is really fantastic. Just really impressed by not only the number of people, but the breadth of different industries that are represented, of different angles that people are bringing to this shared interest in addressing food insecurity through Medicaid channels. So thank you all for being here. We have, as the Medicaid Food Security Network, really put a lot of thought and effort into creating this initial round of resources that we hope are useful to you all wherever you are in the process of kind of looking at implementation of strategies. So Catherine spoke about the Promising Medicaid-Based Strategies resource that is posted on our website. We also have the 6-part video series. You'll get to hear more from Colleen, from Catherine, from Jamila and I as part of that series. Definitely welcome your feedback on that, especially if there's, we're thinking of it sort of as a 101. If there's a 201 topic that you'd like to see featured next, please let us know. We have our partners program, our 4 grantees that we're very excited to work with over the course of the next year plus. And we have that policy dashboard. Definitely put on your calendar a few minutes to spend some time just kind of clicking around and understanding how to use the tool. And we hope that that's a useful resource. On that page, you'll notice that there is a form that you can fill out if there is something that you think should be added, if there's something you think is either not quite right or maybe we should elaborate on. We invite you to use that form as a way to flag those things for us. Could you go to the next slide, please? Thank you. So these meetings are held quarterly. We will have our next one in August. Date and time to be determined, but we know we have a national crew of folks that participate in this network, so we'll make sure that it's smack dab in the middle of the day. Best way to stay apprised of when that next meeting will be is to ensure that you're signed up for our digest. And if somebody wouldn't mind dropping in the join link to the chat, that would be fantastic. Our next digest actually will be going out before the end of this week. So keep an eye on your inbox. It'll feature a lot of what we covered today, as well as the recording and the slides for this presentation. And Audrey, if you could go to the last slide. As I mentioned, if speaking up in the big group setting is not your thing, I totally get that. Here's some contact information. You can reach out to Audrey, you can reach out to me. We also have just a general email address. And if you haven't picked up yet, we have quite a lot of information available on our website. So please do take a look there. And I think with that, we'll go ahead and close. We'll stay on for the next 2 minutes if anybody has questions or anything that they'd like to offer. But thank you all. For my co-designers, thank you all for your contributions to this great agenda. For our amazing steering committee members, thank you for everything. And for facilitating some of those groups. For Zoe from CBPP, thank you for joining us as well. And thank you all. Lots of thanks. Everyone has a great rest of your Wednesday.
I do have a question. My name is Tony Fairhead from Cincinnati, and one of the